Hello, welcome. This is the induction for Trafford Hospital, which is part of the Manchester University Foundation Trust. Welcome. My name is Dr. George. I work as a consultant in diabetes and endocrinology in the Trafford division, and this induction is divided into 6 sections. There is the overview section, or the trust induction. There's also the local induction, which gives you a picture of what Trafford is all about. There's a special section on overseas doctors, and you might already have noticed that there is one on electronic patient record and infection control. Each of these sections will take about 15 minutes or so, and you can of course go back to any of these sections at your leisure if anything is not clear. Manchester University Hospital has got 3 main sites at present. There is the central site, which is probably a familiar picture. That's the Royal Manchester Children's Hospital and Manchester Royal Infirmary. Then there's the Trafford site, which is Urmston and Altrincham, and the Wythenshawe site. You're probably aware that Park Hospital, as it was called in those days, was where the NHS started. The Prime Minister handed over the keys to this hospital to the local council, and the NHS was formed in the 1940s. This is Trafford Hospital as it is today. Probably requires a bit of painting now. This is just a map to show you where the different hospitals are. There's Trafford Hospital here. There's Manchester Royal Infirmary, which is about 6 miles away. And then there's Wythenshawe Hospital, or the University Hospital of South Manchester. All 3 are part of the same trust. You may or may not go to these different hospitals, but almost certainly you'll have Trafford and one other hospital. This is important to understand, particularly when choosing accommodation, and I'll come to that in a later section. Formation of the Manchester University Foundation Trust. Trafford Hospital merged with Central Manchester Foundation Trust on the 1st of April 2012. Subsequently, in October last year, that should have been 2017, University Hospital of South Manchester and CMFT joined together to form the new Manchester University Foundation Trust. As an impact of the merger for Trafford, the 24-hour A&E, and remember this was pretty much a self-sustaining hospital, was downgraded to a nurse-led unit, and it's now only open between 8 a.m. and 8 p.m. Intensive care no longer exists on site, although there is a HDU and a stabilization bay. The admissions are selective, so the number of patients are fewer, and very unwell patients are transferred to other hospitals. There's also no surgery, pediatrics or gynecology at the local on site at Trafford, and this is important when we come to what types of patients we admit. What is the future for Trafford, you might ask? I believe that it's going to be a low-intensity medical admissions unit which will continue, as there's always the need for a resuscitation team and a HDU if surgery is going to take place on site. I think there will be expansion of ambulatory care and a multi-specialty outpatient care. There will also be an elective orthopedics, surgery and orthogeriatrics unit, which I think will blossom on the site. Day case admissions and surgery is much more convenient here, as Trafford has got a lot more space and free parking, as some of you might have noticed. Although, might I hasten to add that parking is only free for 3 hours, after which you will be fined. What is in it for you at Trafford? It's a small but friendly team. There's the ability for you to sort of sit and think about cases, develop your critical thinking, and develop differential diagnoses and your diagnostic abilities. This is very important when you all become consultants and start taking responsibility for patients. There is the outpatient experience and the opportunity to develop your teaching skills. Now, who are your contact persons? When you work here, there will be an educational supervisor and a clinical supervisor. They fulfill different roles, as I have mentioned on the slide there. One provides you with a trajectory. Where will you reach in a year or 2 years' time? And that's your academic trajectory. And this person, who is your educational supervisor, will have a review with you regularly to ensure that you are on course. The clinical supervisor, on the other hand, will provide you with regular support and guidance on a day-to-day basis, and perhaps supervision week to week, and he or she will be signing off your documents. There is a full-fledged postgraduate education team that is across sites, so I have put up the names here and you can review them at a later time. The core medical training lead is in South Manchester, and that is important to understand if you have any need to contact Dr. Pippa Newton. There is a local library on site, and Helen Collantine is the person in charge. College tutors, their names are up on the screen. Dr. Chilala is the Medical Royal College tutor. I look after international medical graduates, but of course my door is always open to anybody who wants to discuss career options or anybody who's interested in diabetes and endocrinology, or any specialty for that matter. So who do you turn to? If you have clinical matters, go to your clinical supervisor. If you are worried that your education and training is not up to the mark, you need to contact the DME, who is currently Dr. Mark Forrest. However, it would be worthwhile discussing with your educational supervisor or me to see if we can rectify the problems you face. Some of the issues may be to do with the fact that you can't attend outpatient clinics because of clinical commitments on the ward, and we can make adjustments for that. Your health is very important to the team. We do have an occupational health department, and although there is although the site at Trafford is not permanently open, there is a telephone number to call, both here and at MRI. The numbers are up on the screen now. There is a lot of information on the internet, and I'd urge you to have a look at it as soon as possible. Information regarding needle stick injuries, gym membership, cycle scheme, and importantly, an educational resource is uptodate.com. Now, it is important that you use it, review information as you're seeing a case. And of course, if you log in with your Athens password, you can get this from the library, you will be given at the end of the year a certificate with the number of CPD points you've got as a result of using UpToDate. And this is useful when it comes to your appraisal at the end of the year. GMC, no induction is complete without ever mentioning the GMC. You will need to be aware of good medical practice, and there will be in the future an induction series on good medical practice. The intranet at MFT, although I think it's slightly difficult to find information on it, is sort of buzzing with a lot of important information, including antibiotic guidance and different departments that we have. Whistleblowing. Now, if you are concerned either about a colleague or care of patients, you need to tell someone, and it needs to be somebody who can make a difference, the shakers and the movers. If nothing happens, go up one further step and make sure that something is done, particularly if patient safety is at risk. If you are working for long hours on the ward, far in excess of what your contracted to do, you need to make an exception report. Can I remind you that this is only for deanery trainees and not for international graduates at present. Of course, this doesn't stop anybody working here from discussing with either me or the clinical head of division if you're feeling that your work hours are in excess of what you've been contracted to do. You should expect total confidentiality and you should be supported. I'd like to know if you're not, particularly if you feel that you're being bullied, if you feel that your work environment is hostile. You can discuss it with any of us, and we would of course respect your confidentiality. Now, there are plenty of leadership opportunities. Junior Doctors Forum bi-monthly, which takes place at Manchester Royal. This takes place at Manchester Royal. There's also monthly meetings at Trafford with Dr. John Mason, who is currently clinical director. There's a lot of opportunity for service development, including audit, professional development, and the role of an associate college tutor. If any of you are interested, please do contact Dr. Chilala. There are lots of training opportunities, particularly weekly grand rounds on Thursday in the boardroom. There's often a free sandwich along with this. There is the Elderly Journal Club, which takes place on Tuesdays, and there are medical training initiative study days, which takes place 6 days a year, and I set this up either at MRI or at Trafford, and is mainly for general medical trainees, but it contains a wide variety of different medical topics. Mandatory training needs to be completed within 28 days of starting. Now there's corporate mandatory training and clinical mandatory training, as well as an induction sign-off. You also need to ensure that you are well versed with infection control techniques and get that signed off. You'll also need to sign a self-declaration for medical devices. Study leave, please organize yourself and apply in advance. If everybody wants time off over Easter, that makes it very challenging on the medical rota. We'll of course try to honor any request that you have or any special circumstances, but it is not guaranteed. First come, first served. You need at least 6 weeks notice. If you fall sick on the day or you have diarrhea, vomiting, which prevents you from coming into hospital, you do need to report to medical staffing, rota coordinator, your consultant supervisor and colleagues to ensure that work progresses smoothly. Now, it is important to provide feedback. There are monthly meetings with the clinical director of Trafford Hospital and the manager. This takes place on a Thursday as soon as grand rounds is over. This is your time to voice your concerns, and you will be listened to. And take it from me that everybody tries really hard to make things better and safer for the patient as well as for yourselves. We may not be able to act on every suggestion that you make, but we'll certainly try. You can contact your supervisor. You can do incident reporting. Now this is on the intranet. The first, as you open the front page, you will see on your right side there is an incident report. This could be reporting of anything which you're concerned about. This might include feeling unsafe on the ward if you're not provided with adequate supervision. Bear in mind that the more you report, the more likely things are to change. You can contact your lead, you can contact the clinical director, you can also provide anonymous feedback. Please do let us know in time so that your problem can be rectified while you're still in post at Trafford, rather than you going through with a unfulfilling post. Antibiotic guidelines. This is present. This is a free app that you can download from iTunes or Google, and it is very good, in my opinion. please do download it and have a look through. This will help you, particularly when you're on call. You can use it offline as well. Other things to know: the library is open during the week. The restaurant is not open at weekends, so you'll have to bring in some lunch. The best coffee is available across the road in the one-stop shop where there's a Costa coffee machine, but sandwiches are available, and this shop is open 7 days a week. There are showers in the doctor's mess as well as on AMU if you plan to cycle into work, and also secure cycle storage areas. That's the end of the first part. If you have any questions, please don't hesitate to email me at drgeorge at pabu.com. At pap2u.com. Thank you for your attention.